Periscope.
All right, we're going to put you on mute, doll.
Okay. As we're gradually moving back to opening schools and businesses and, of course, our in-person interactions, I want to remind you, this is all time with cold and flu season getting going. Staying hydrated is key to helping your body deal with the added stress and with the upcoming flu season. My regular fans have heard me talk about a product called Hydralyte for a long time now. It's an amazing rapid rehydration drink. It's a mix that, well, we're obsessed with here. I'm excited to announce they've just released Hydralyte Plus Immunity, just in time for cold and flu season. Hydralyte Plus Immunity starts with their fast-absorbing electrolytes and adds a host of immune-boosting ingredients. Each single-serve, easy-pour drink mix contains 1,000 milligrams of vitamin C and 300 milligrams of elderberry extract, creates what is hopefully immune-boosting formula that's high in antioxidants and zinc. Combining this with Hydralyte's 7 key electrolytes, it's a fantastic way to stay proactive and properly hydrated. Hydralyte Plus Immunity comes in convenient, easy-to-pour powder sticks that rapidly dissolve in water and make a great-tasting drink that has 75% less sugar than your typical sports drink. It uses all natural flavors, and it is gluten-free, dairy-free, caffeine-free, non-GMO, and it is vegan. And you can find Hydralyte Plus by visiting hydralyte.com/Dr. Drew. Again, that's hydralyte.com/DRDRW. And be sure to use our code Dr. Drew 25 at checkout for a special discount.
Hey, everyone. It's a dose of Dr. Drew.
It is indeed. I don't think my mic's on. There we go. And we're trying some interesting stuff today. We're trying to combine technologies here on this streaming program. And we are going to take calls from Instagram. There is my Instagram site. If you'd like to head over there, there's an Instagram live stream going as well. And that's where we will get our callers from for the next few minutes. Instagram, I have found Instagram to be a pretty cool place, and so I wanted to get that world engaged in this whole streaming situation. I'm also watching you guys on the restream, so I see you all. And reminder also, we are building up a TikTok as well, and you might find that kind of interesting. There it is. It's been really a lot of fun to work on TikTok. I got to tell you, and you can sign up there, follow there. Just trying to answer your questions there. We might morph it into something else as well. But my son, Jordan Pinsky, has been working very diligently on getting me on board with TikTok. It's been a lot of fun. Plus, when I was sick, it's something I keep saying, and I'll say it to our Instagram friends too. When I was sick, I could only just sit there and scroll on my phone. That's about all I could tolerate. I was so damn sick. And I was so appreciative of content providers because it felt like a relationship because I was isolated. I couldn't be around anybody, right? And I had TikTok and Pluto TV. Those were my friends for about 3 weeks. Let's get to my guest. It is Rachel. She's coming in from Instagram Live, which we're on right now. You can check that out as well. Rachel, in Minnesota, what's going on?
Hey, not much. Not much at all.
Hey there. You had a question or a comment or something? Mommy Jeans?
Actually, I have a question.
Mm-hmm.
I am getting my second Moderna shot on Tuesday. Little nervous. It wasn't bad the first go around. Just wondering, I guess, stats on that vaccine and if you actually get hit pretty hard with it.
Some people get a little more from the second vaccine. Have you had COVID yet?
Have not.
Okay. In my experience, there's not a massive distance between the first and the second. Like the person who's telling me I've had fatigue and sleepy on the first one, get the fevers on the second one. Though not necessarily. Sometimes it's the first one they react to. Sometimes it's the second one. It's just more often than not when people say, I kind of had sleepiness for a day or two, they'll have a little more on the second one, which is good. Your immune system is responding to the vaccine. I put out a couple TikToks where I was saying you shouldn't use Tylenol or nonsteroidal agents for the couple days leading up to the vaccine, but you definitely should use them after, right? Because a lot of this is inflammatory. So Tylenol, Aleve, Motrin, that can help after. You're also not supposed to use alcohol for about 3 days after to optimize the effect of the vaccine. So that's it. But I am all about it. I think I'm gonna get Johnson & Johnson just because I don't want to take 2 vaccines. But these are really, the data is flying in how good these things are. So congratulations.
Right.
You'll be free to move about, a little freer to move about.
I know. It's nice. I can't wait to actually have things open.
Isn't that crazy? And I know there's been, the government is pushing mask, even after you've been vaccinated. And the idea is first of all, we want to make sure that people can't transmit it after they've been vaccinated. That data is looking very good. We also want to be sure that people aren't going to get the variants, because if the variants take a foothold here, it's going to be kind of nasty. I think you're pretty good up there, Minnesota. I think you can rest assured you're in pretty good shape. Okay?
All right. Sounds good.
It's great to see you. Thank you for stepping by. You're your mom's house fan?
Of course.
Main mommy. This is the main mommy here, guys.
Yeah.
Check out your mom's house. Now, I've done this a few times, and I've already forgotten how to get somebody off the page once you're on. If you just drop off.
Are you looking at your restream too?
I am looking at restream. Is there
Say
something
hi to
on there?
everybody.
Oh, yeah. I saw them all. Bye, Rachel.
See you later.
Thank you. We'll see you soon. Bunny Bubs is saying, I think we'll need a booster at 6 months, at least yearly. I think you might be right on that, particularly with Moderna. They're going straight ahead with it. And Bunny's saying, oh, no, my friends had drinks right away. Wait, what are you saying there, Andrew? 2 weeks later from easing all restrictions here in Texas, one of the biggest hospitals in Dallas closed the COVID unit. Yeah. Joe Giannotti put up a ton of data on closed hospitals, beg your pardon, shut down states versus wide open states. And the virus did what the virus did. It just followed the same pattern no matter what. It does not, we want to believe that we're doing something to reduce or mitigate. It's not clear that we are. I'm going to speak to our very fine oncologist, hopefully later this week, maybe next week, who has been making a little noise. He's got this podcast called Plenary Sessions that I listen to, and he is a super smart guy, and he's making some very careful thought. He's thinking things through carefully, and he's talking about things that, I've been worried about this whole time. Let's see. I'm going to look at you guys.
Joshua Barzell, one of our long-term friends on Facebook, he said, are we still using Clubhouse? Yes, we are, but we thought we'd try Instagram Live today so that everybody can access it if they feel like asking questions.
But Ashley MC is asking, what do I think about the people that are cutting the vaccine line in Los Angeles, which is lots of young people are doing that. They're going in. Here's the conundrum. Our state has been insane in how it's rolled out the vaccine. And part of the insanity, they have forced people to lie. Literally, I don't blame people that are lying. It's not right. It's going to affect their moral compass maybe the rest of their life because it's young people that are doing this. But the state has forced them into this position. So what the state has done is said, if you have any kind of cardiac or medical condition, you get to get in the line. But because of HIPAA laws, we can't ask you about any of those things. So you can say anything you want, and no one can say anything towards you. No one can ask any questions. Pathetic. And then so I would say the operation of the rollout in California has been nothing but disgraceful from top to bottom. At first, it was we have to get risk populations. They did a poor job doing that, and they didn't have any ability to have multiple priorities like teachers or people that are treating COVID patients as outpatients, or maybe doctors they want to get into overflow unit. None of that was a consideration. No. Then we open it up, and now we put this policy in place where if you have any kind of condition, you're good for it as a young person. However, we can't ask you anything about it, and therefore people are now lying. So it's perfect. Anyway, it's going to be open to everybody soon enough anyway, so it's hopefully won't be a big deal.
I know. I think we get to go next week.
Do you want me to go? I've got to talk to the additives people about that. I'm going to see when they want me to go because I want to still. So it turns out that for the immune response to COVID is one of three categories. You have an immune response that rapidly declines. Another third is an immune response that decays more slowly over 3 months. And there's a third group, another 30% that I'm a part of, that are staying highly immune at 6 months. I am 3-4 months out now, and my antibody responses, my neutralizing antibodies are at 95%. My binding site antibodies are at 105,000 or something crazy like that. It's insane. So I'm staying up. But because Susan and I want to have some international travel for our 30th wedding anniversary, they're going to require me to do
Greece
that.
is calling my name.
Yeah. Let me see who's in the line to want to come up here. I'm looking at your request, and I'm just putting who's ever at the top of the line there. I'm not looking at the names, I'm sorry to tell you. Hi there.
Dr. Drew.
Hey, man, what's happening?
How's it going? It's
Good.
JLC. We met each other once at the Hollywood Improv.
Oh, for God's sakes, how are you?
Yeah, I'm great. I had to sit down for a couple of years, but I'm out now, and everything is going absolutely spectacular.
Excellent.
Yeah, I just had a quick question for you.
Yeah.
So I took, I got back, tried to get back into weightlifting because they locked us down in the prisons during COVID. So for 100 days, we didn't leave our cells. People were dying in the pods by us. They didn't give us food. They didn't give us, they didn't give us our food on time. They didn't give us the right food that we were supposed to be getting. They gave us cold meals, and we didn't shower for 14 days.
Wow.
When it first started, when they first locked down the prison. We didn't leave the cell. We weren't able to make phone calls to our family, nothing like that. This went on for about 100 days, and then when I finally got out, they had to throw me in quarantine. So they threw me in a prison within the prison. They threw me in the hole for 14 days before I got out.
That's crazy.
Yeah. Anyways, during that time, I gained a little bit of weight. I was gotten really fit. I was like 175, pretty lean on the inside. But anyways, my question to you is, so I got out, I gained some weight, I tried to get back into it, so I was eating a lot of protein, I was going hitting the gym, but I started taking a supplement. It's non-steroidal, and I believe it's called a PPAR modulator, and it's called MK677. It regulates like the pulse of your growth hormones.
Looking it up. Okay, oral active growth hormone. Ibutamoren,
Right.
a potent long-acting orally active selective non-peptide agonist of ghrelin. Growth hormone secretagogue. Maybe. I mean, again, most of these supplements, I mean, somebody your age, the deal is just cut out the carbs and increase your intensity of workout. I mean, you're going to be fine.
I have a question for you, though. So I took it to get bigger, and I only took it for about 2 weeks, half the dose of what I thought it was.
Mm-hmm.
And then I added in another thing called Cardarine, and it's supposed to help with like your muscle, your cardio, and like your muscle fiber changing. So what happened was I stopped taking it to go back natural again, even though this stuff is non-steroidal. And what happened to me is for like about a month, I had extremely horrible, like debilitating cluster headaches. I started throwing up.
I would not assume that has anything to do with any of this stuff. I mean, you need to get that worked up, right? It may have something to do with it, but you can't immediately just assume that, right? You have severe headaches and vomiting. That is something that needs an evaluation, right?
Right. So I went to the hospital. It actually got so bad I started vomiting once.
Okay.
And it got so bad they said you have cluster headaches, and I was actually looking into mycelium of the magic mushroom to cure those headaches.
Look,
but
my friend, you stop treating yourself. Will you stop it? You need.
But they went away.
Good, but I doubt it was actually cluster headaches, by the way. But okay, and just do me a favor. You don't treat yourself for medical problems. Just you don't. No one does. You can't be objective about yourself or your response to treatments. You have to have somebody doing that. All right, buddy. What is the significance of the ring? The evil eye?
Nope. It looks like an evil eye, but it's actually the eye of God. You know what I mean? Some people might perceive it to be an evil eye, but no, it's not.
You doing okay? You got work?
I'm doing amazing. How are you?
You're working and you're sort of thriving?
Absolutely, yes, sir. I'm actually starting my own business now.
All right, good.
Yeah.
All right, buddy. Good to talk to you, my
sir.
friend.
Yes, sir. You have a good day.
All right, thank you, buddy.
Reach out to the After Disaster.
Yeah, I will. I see those guys. I talk to them once in a while.
I think I'm going to start my own podcast, and I'm going to call it The Aftermath.
Good. Well, people might be interested. People are interested in what happens in jail and prison, so it could be very interesting, especially during the lockdown. I know there was a lot of shenanigans going on.
Oh, yeah.
All right,
but
buddy.
I'm an enlightened being. Only enlightened beings on the Merkaba of love. I just spread the love. That's what I'm about.
Excellent, my friend.
You know?
Take care of yourself. All right. I'm looking at the restream again. Okay. Is he on any drugs right now? Diagnosed bipolar on lithium, 4 years, caused weight gain, hypothyroidism. So now I'm off lithium, was out of on hypothyroid meds. Do I have any recommendations for weaning lithium? Jessica, you can usually wean pretty quickly, provided you get on other mood stabilizers like lamotrigine or Depakote, something like that. So you really... OM Rider, my thoughts on the Echo Park situation is that's what we need to do for homeless throughout town, which is move them into facilities where they can get housing and help. That's what they did. They put the folks in Echo Park into housing. They're all in hotels now. They're all getting treatment. And people that are homeless won't do that unless you move them on in, which is what they did. They were living in circumstances that were unsanitary and unsustainable. The city did what they are supposed to do, which is take care of their citizens. If you're not interested in those people getting help and getting housing, you're interested in them dying, because we're losing 4 a day on the streets now. So if you continue to privilege something called anosognosia. See, people with serious mental illness and substance use get this thing called anosognosia, which is a block. A piece of it is denial, but there's actually a biological block in the ability to see what's happening, why it's happening, and what you need to get better. If you privilege anosognosia with people with serious mental illness and substance use disorders, they will die. So you must break through the anosognosia, and it's very simple. You just go, here, let's take you over here, and we treat you. That's it. Anthony Brown in the house, Tom Cigar, I see that. Oh boy, in India, I don't know. Somebody asked a good question up here. I'm looking for it. Dextromethorphan addiction. I have dealt with that. It's a rather serious addiction. Dextromethorphan is a cough syrup addiction, and people have to drink a lot of it to get addicted, so much so that they get sort of a ketamine and a methadone effect simultaneously. They get some dissociation and they get opioid effect using large amounts of it. It's very serious addiction when it gets going. Of course, there's a lot of alcohol in there too.
Is that how people get addicted to it? Because there's alcohol in it?
No, they get addicted because they hear and read about it. I was just thinking to myself, I don't want to really promote the fact how they use it. But they, find out how to use it, and they do.
Well, that's why you can't buy more than one bottle when you go to the CVS anymore.
Yep. Let's see. Rob Roy, L.A. Let's talk. Whoops, sorry, Matt. It changed position here. Matthew comes up. Michigan COVID numbers. Yeah, Joe. What do you think that's all seasonal?
That's the question.
Joe Giannotti says the numbers in Michigan keep going up, and his theory is that it's all climate related. Is that Matthew? Is that you?
Hey, what's up?
Hey, man, what's happening?
Not much.
Any questions or anything?
Yeah, I have a good question. Is there an antidote for Vivitrol?
For
Vivitrol?
An antidote for Vivitrol. In other words, once you get the injection, it's in your system for 30 days, right? Now you can give me the specifics of your question. Why are you asking this?
Say if I cut something happens where I go to the hospital.
Yeah, you can get past it. There's ways to give medication to get past it. So don't worry. I talked to Dr. Pisano, and you answered it. It blocks obviously a lot of the opiate receptors, but there are ways to kind of manage that. Somebody who knows what they're doing can kind of make it okay. It's not something we would likely be prescribing if you could not get any analgesia ever when you were on it, right? That doesn't make sense, does it?
Right.
So,
and I'm going to ask you another question. What do you think about kratom? I think I heard you talk about that.
About what?
Kratom.
Kratom is a weak opiate. You want to avoid that at all costs if you have addiction. It's not a good idea. There are people that sort of maintain on it just the way they maintain on other opiates or cannabis. But if you want to be clean and sober, that is not a good idea. The Vivitrol is a naltrexone-like drug, the opioid blocking system. It's good for alcohol. It's good for stimulants sometimes. And if somebody's an opiate addict and taking Vivitrol, it's a little bit of a different situation. I'm not even sure it's indicated for that. Let's see what Stacy wants to know here. Hi, Stacy. You there? Mm-hmm. There you are.
Hi.
Hey.
How are you?
I'm good. How are you?
I'm good. I have a question.
Mm-hmm.
So my parents had the first dose of Pfizer.
Mm-hmm.
Then they got COVID.
Wait, hold on a second. So they got COVID. How long after the first dose?
I want to say 4 or 5 days.
Right. So they probably they either A, got it before the vaccine, or B, hadn't mounted a sufficient immune response and got it. Okay.
Yes,
that
absolutely.
That
absolutely. Actually, my papa had it, and he's 95. He's in the hospital, and my stepdad went to say goodbye to him. Sorry, I'm going to get a little choked up there. Anyhow, that's how we believe that that they got it. But my question is, they both had the monoclonal antibodies, different ones. My mom had the BAM,
mm-hmm.
and he had something that started with a T.
With a P?
No, a T as in Tom.
T.
He was hospitalized for 8 days. Never ICU, though.
Mm. And
so my question is, do we do the second dose after 90 days, or would we not?
I think so. Let's see. You should, for sure, his doctors need to make those decisions. Let's see if I can come up with the T antibody for you. Yeah, you have it, Susan?
Yeah, I can pronounce it if I had to.
I
anyhow.
remember like,
you sure it's not
I
ET?
remember like translevalamp.
You sure it's, that's,
yes.
you're thinking of toxilizumab. That's a little different.
Toxilizumab.
That's different.
Yeah.
I don't see I don't have a good list of them for you here. Hold on. Let me see. There's the etesivimab, which is given with the bamlanivimab now. So I don't know what the T one would be. Is that Regeneron, perhaps? Anyway, it's not important. They got it. They're better. Excellent. That's awesome. My sense is that they would get that second vaccine, but you may want to wait a little longer than when are they due for it?
Well, it hasn't even been 90 days yet.
And, but when did they, how long after they recovered is the vaccine due? Like a month? You know what I'm
Well, it was supposed to be 3 weeks. They were scheduled.
Yeah, that seems a little aggressive to me, because I don't know if, for me as a patient, I would be like, oh, what if I have a reaction? I don't want to deal with that. I want to get stronger first, right? So I imagine they feel that way. So talk to their doctors about delaying. And although Pfizer does not recommend, go ahead.
Here's the funny thing, that one doctor says, no, don't get it. And the other doctor says, get it after 90 days.
90 days from the first one.
From the first one.
Okay, so the experts agree, as usual. Here we are.
Exactly.
Experts agree. I can only give you my perspective as a patient, which would be I would not want to risk that you can get a couple days of not feeling good. I would want to be stronger before I did that. So that would be my patient perspective. I know Pfizer is not recommending waiting more than 90 days. They don't like you to do that, but it's not that big a deal. I personally, if it were me, I'd listen to the doctor that said wait, and I'd ask him or her, exactly when we can get on with it. So thanks, my dear. Thank you so much. Lots of good questions coming in on my restream here. So hold on, everybody. Okay, so somebody at Twitch wants to know my pedigree. So I went to Amherst College, USC Medical School, MD, then 4 years of internal medicine with a chief residency, then ran medical services in a freestanding psychiatric hospital, and then took over their addiction services, became an addictionologist, both board certified in addiction medicine and internal medicine. I ran that program for about 25 years. I had both an inpatient medical practice, ICU practice, an outpatient medical practice, and the addiction services going simultaneously. So yes, I've seen a lot clinically, a lot. Sometimes 60 plus patients a day for long periods of time. I also had a nursing home practice at the same time.
I remember that.
When I used to go to nursing homes.
Oh yeah, that sounded lots of fun.
Yep, I used to do that on the weekends.
You were so good at it though. They loved you over there.
I know. Let's see. Let's try to go through your calls and questions here. I'm looking at I'm away from you guys for a second, looking at a restream chat. Evan, you want me to talk about pilonidal cyst? That's not the most exciting topic in the world.
What is it?
Demi Lovato using alcohol and marijuana, so-called Stephanie, so-called California sober. It's not a good idea. I've seen many people try that. It doesn't work. And it's sort of astonishing, isn't it? After having had strokes and a near-death experience, she still insists on doing that. The thing about recovering from the addiction like she has, you have to surrender to the process. And the fact that she's allowing her judgment to determine a relationship with a substance doesn't usually end well. But she has to find that out for herself. Okay. Yes, appeal process for insurance is ridiculous. Yes, it is. You are absolutely right. Let's see. Addict score, somebody's asking. You can get that from Easy Testing, EAZY testing in California, but only in California. Let's see here. Sorry. Is it dangerous for the vaccine if you have high blood pressure? No, it is specifically indicated for you, in fact. My psychiatrist said if I get off gluten and eat clean diet, my mental health will improve to the point no longer need medication for bipolar. Jessica, that's a little bit optimistic, but people do find mood improvements and psychiatric symptoms off on keto diet particularly. There's been some data on that. Very light case of COVID, both vaccine. Why would I need to wear a mask? Holly, Bill. Bill had COVID-19 and had both vaccines, and why does he need to wear a mask? The only reason really is the variants, and the fact that we haven't proven yet categorically that you can't transmit this disease after having had the vaccine. So it's very unlikely, but that's the reason you would do it. Oh my goodness, yeah. Well, someone here in Twitch is asking about a friend who's addicted to fentanyl will not get treatment, and that is why we have homeless people. That's what that is. Unless you can create consequences, their brain gets locked into this progressive syndrome that they can't get out of, and that's what's pathetic about our ability to help people. Oh, somebody said that Vivitrol was indicated for opiate addiction. That's what I wanted to address. And yeah, well, it is. I'm not sure it's on label use, and it's a little concerning. It's in terms of, oh my gosh, it's something that is a deterrent, right? But I've seen people use through Vivitrol, so it doesn't necessarily change the desire to use or the probability of a relapse the way it does seem to do for alcohol, as far as I know. Now that may be wrong. Maybe I missed that the research somewhere. Let's see. IGSR Savage. BCG vaccine. No, I didn't see that have any significant effect.
Are there any questions on Instagram?
I'm looking at that right now. Okay, I'm gonna have to scroll back. I'm sorry, you guys. I'm looking away from the camera here to read someone's stuff. Okay, to take antihistamines before and after the vaccine. As far as I know, that is fine.
Good question.
What do I think of Toradol for MS? Toradol is an excellent medication for pain. It's a non-steroidal anti-inflammatory agent, essentially.
Any more people want to talk?
Best way to get off 1 milligrams of Klonopin daily for years. Carefully managed detox. Even at a milligram, if you can get down to about 1/4 milligram a day, it's going to be much easier for you. So maybe a slow taper to there.
Can you explain to people on Instagram how to see the live stream?
So on Instagram, you guys, we are on a live stream right now where we are live at drdrew.com, drdrew.tv. Is that true also, Jordan?
Yeah, all the links are there. For YouTube,
also, Facebook, Periscope, Twitch, and YouTube, where you can watch this in live. And
if you're on Periscope, it's going to go to Twitter, but we're not sure what'll happen to the Periscope. So move on over to YouTube or to Facebook.
Right.
Or Twitch.
And if you sign up at drdrew.tv, we'll send you a little blast when we go live, which we do on most days. And today,
no, we don't. We don't send out a blast when
you
we're
don't
live
do that
from
anymore?
Dr. Drew TV.
Oh.
No. Remember, you want to get rid of the email.
I do,
but
I thought
occasionally. We do. But if you're a local, if you're on Locals, drdrew.locals.com, you will get a notification before we go live.
Ah, okay.
And also, you might just check out our Twitter and see when our next show is, because we'll promote it there. We'll promote it here on Instagram Live, Instagram as well. But if you want to get on the mailing list when we do a big show and we send out emails, you can go to drdrew.tv.
Wiz Chris asks, how would you feel as a professional and provider when insurance company make you take additional time to appeal medications, therapies that you prescribe? Wiz Chris, doctors spend about 1/5 of their time doing that, I would say. On average, I spent about 20% of my time talking to insurance companies and getting essentially nowhere. Then when the patients call the insurance company, what the insurance company tells the patient is, oh, if the doctor would just tell us what we need, we would definitely do it. What they don't tell you is they set their standards. They set their own criteria that are arbitrary, spurious, set by somebody with a code book in multiple states away from where the patient actually is. Then, when I have been in that situation and made a complaint about it or appealed it too much, the insurance company then goes, oh, I see, Dr. Pinsky, you don't like how we do business. How about we decertify you? And in fact, if you make a complaint to the California insurance, what's he called? Like, there's an insurance czar, essentially. How about we decertify the whole hospital? That's the game they play, Chris. That's the game they play. It's fantastic. It's fantastic. All right. Let's see here. I'm trying to go live. I'm sorry, I can't see who. Here we go. It's harder to do than you imagine. I think this is David.
You do a fabulous job.
Thank you. Good encouragement, good positive reinforcement. Way to go. Dave, is that you?
Oh, hi, Dr. Drew.
Hey,
first-time caller from North Wales.
Nice. Love it.
Actually, making a question about the psychological effects of marijuana, if you're comfortable to talk on that.
Please, let's go.
I have a relative who's been using it to sort of stabilize a very bad temper for many, many, many decades at this point now. Mm-hmm. And I was wondering, is this something, do you think this is a behavior that's so entrenched that it likely should not even possibly be changed? Because frankly, it does make it more functional on a day-to-day basis.
Certainly, it depends how much they're using and whatnot. You have to sort of evaluate that given individual. The first thing I'd want to know is there a family history of alcoholism here? So that would increase. Was there a personal history of alcoholism?
With this individual, yes.
Yeah. So he's an alcoholic, right? So he has a specific genetic makeup. That's a specific thing unique to that condition. And if you get going too far down the road with certain substances, benzodiazepines, cannabis, alcohol, it sort of has its own momentum to it, and there's a liking system and a wanting system in the brain. And with addicts, the wanting system takes over even when you don't like it, right? So, and so what I'm suspicious, I've had many patients that start to have real problems from cannabis. Their families complaining, their workplaces complaining, and and interestingly, I've had at least a half a dozen say the following thing: "I'm an asshole without it. It affects I'm an angry bad person without it," which may be true, may be true. And certainly, if you're having, you're craving it and having withdrawal from it for a few weeks after you stop, you're going to be an asshole too. I mean, that's certainly a possibility. It depends what he wants to do. It depends how much it's affecting him, right? I mean, this is not psychological. But we're talking about brain biology, strictly here. What is the optimum thing for this person who's treating himself for something non-specific that we don't know what it is, and maybe starting to have takeover of his underlying biology where he keeps using something even when it's not working anymore. Does that make sense?
I see. So this is sort of more reflexive now at this point rather than...
It is. Just think in terms of the two systems. Liking, wanting. He likes that he's better. It was working for him. Maybe it's not working so good anymore, but the wanting system is taking over. He'll keep insisting that it's working even when everyone around him tells him it isn't. Does that make sense?
Fair enough. Yes. Thank you very much for thank you.
With that.
Rational Revolution.
Cheers. Yeah. Rational Revolution. Absolutely. We want to, Christina P. and I on Dr. After Dark want to restore rationality. We desperately want to restore rationality. That there's an excessive preoccupation with feelings. Feelings are valid, but they're not true. They don't necessarily reflect something factually true. And we've lost track of that in this culture somehow. If you feel something, it is so. And that's simply not true. Okay. We're looking at your questions.
So my psychics feel stuff all the time.
Correct.
I feel like, and I feel like.
Well, that's an intuition, right? And they're not basing their interpretation of reality based on those feelings. They're raising those feelings, it seems to me.
Who knows?
They're not saying, I feel like, listen, there's way too much. I
like treating yourself with mushrooms?
No, you're off target here. I feel hurt by something you said. Yeah, okay. There should be an apology if that doesn't mean what I said wasn't true or meaningful or important.
Oh,
That's all. That this over reliance on feeling states and that feeling states determine reality. They don't. They help us interpret and sort of figure things out, but they can be. Feelings can be problematic. We have to evaluate them. We have to look at them rationally. That's all I'm saying. You when you end up strictly in feelings, you're in a part. Right, we did the whole thing with Alan Shore about the right brain. The right brain is more holistic and irrational, non-conscious, and you can lead you in not great directions. Read Daniel Kahneman's book.
that was a great podcast, by the way.
Like the
with
Thinking
Dr.
Fast
Shore.
and Thinking Slow is exactly about this. Look at Thinking Fast, Thinking Slow. It's a great book. You can
Check out the show we did last week with Dr. Alan Shore.
Yeah. You can get the HPV vaccine, leaping lizards, at 30 years of age. I would strongly recommend it if you're having any exposure. We'll put that up again, Jordan, if you could. Dr. Shore is one of my heroes, and we did a very good podcast with him. It's up. Right brain psychotherapy. So
I like the music. It's kind of cute.
I know, I do too.
No, he was very interesting. I like that show.
Yeah. Yeah, depression and the increase of it and how the therapists are so backed up. I know that's crazy. Listen, all my psychiatric friends say all they're seeing is depression, anxiety, particularly in adolescence right now. We've created a mess. All right. Okay.
Let's head on over to Restream.
I'm there right now.
There are some people on here. They're like, please answer my call.
Where is that on Instagram?
I don't know. I saw it. Do they like line up somewhere, or how does it work on there?
Oh, Anthony, what's your career change? Don't do anything brash. Evan says, can you heal your brain from multiple concussions coming from a wrestler, football player? I mean, it's hard to predict, right? I mean, chronic traumatic encephalopathy, CTE, happens. Some people have real symptomatology from it, and others live with it and live a normal lifespan. It's why there's two different camps. It's hard to predict. Thanks, Jenny Lee. Appreciate that very much. Why are you on my Instagram in that case? Yeah, I'm mentally ill. I have a birthday. Can I get a shout out? Okay, perfect. Ugly. Shout out to you. That's what the I'm a heroin addict now on Xanax prescribed, and I want to function off any narcotics. Listen, Sarah, Victoria, go to Narcotics Anonymous. Go to meetings, raise your hand, say you need help. You'll be surprised how much help you can get there. Doctors' opinions do not change facts. Shouldn't believe me. Do your own research for sure, says Stacy. Okay. Can right brain healing occur when bonding with a newborn baby? Marley, it's not really, that's not, if you can form a secure attachment with that child, the individual who's forming that attachment can get a little better. There has been some research that shows that it's mostly in like committed long-term relationships that if you can get a secure attachment, people with attachment insecurity can become more secure. I've never seen that with infants though. So it essentially whatever your attachment style is what the infant is exposed to. Let's try 1 gram army. Let's see what that is. I picked you 1 gram army. There you are. Oh boy. All right. There you are.
I hear him.
Hey, Dr. Drew, how you doing?
I'm good, man. What's happening?
1 gram.
Hey, good. Yeah, so, I mean, I know generally most of the questions you get lately are about COVID and people asking you to predict the future and things of that nature. But I wanted to ask you something about something you may know more about. So I've been smoking I'm 36. I've been smoking cigarettes since I was like 17.
Yep.
And I finally, legitimately picked a quit date, and it's tomorrow.
Good.
And I've been doing a lot of soul searching about it lately, but I'm genuinely afraid because I also quit drinking recently, and I'm honestly afraid of maybe giving up too much at once.
People have actually studied that, and it's better if you do give it all up at once. There's actually better outcomes.
Okay.
Yeah, better outcomes. Now,
yeah. Well, I guess you just ride through the storm early on, and then it's all done at once.
I will tell you what I have used a lot of. Nicotine replacement, so gum and lozenges and patches, that kind of thing. And the other thing is varenicline, Chantix. About 30% of the time, Chantix really works. Have you ever tried that?
Actually, when I was in the Air Force in the early 2000s, and I don't remember what the drug was, but I think it was initially an antidepressant, and it just sort of had this side effect that it made cigarettes taste really bad, and they gave it to a lot of us.
That's
along with a lot of
Vivitrol.
other things. The untested anthrax vaccine. They put a lot of stuff in us in those days, but it really messed me up mentally, though, when I tried to quit smoking that way, and vivid dreams and things of that nature.
Right. So that medication was called Zyban. It was approved for ending smoking. It's Wellbutrin. Chantix is better, but it also can give you weird mood changes and dreams and stuff. It can. So if you can get through it without, so much the better. Just that first 2 weeks is the toughest part.
All right. Well, I appreciate it, Dr. Drew. I won't keep you any longer, but it's just was on my mind, and you were on. And you better believe I'm coming up in May.
Mm-hmm. Thank you, Mommy. Congratulations.
Right,
big deal. It's a big deal. These are hard.
I appreciate it.
It's hard to do this. So congratulations, and thank you for your service, of course, too.
How come I don't get I'm coming up in May?
You have to watch some of the videos that Christine and I watch.
I know. I'm curious, though.
You better believe I'm coming up in May is what...
what does that mean?
Just don't worry about it. It's a crazy YouTube video.
It must be nasty.
There's a lot of crazy YouTube videos that
like dirty or something
that Christine and I watch, and some of them are, some of them are not.
I want you to do like a behind the scenes how you feel about those videos on Locals. Like just talk about like what I'm coming up in May really means to you, just for supporters only.
Okay.
We kind of talked about that with Ori.
Okay.
Yeah, we need some dirt.
I mean, I gotta say, Tom Cigar is going nuts right now with a lot of memes from your mom's house. So he's on Restream.
If you go to drdrew.locals.com, you can join our community. It's only $7 a month, and we might do some behind the scenes stuff with Dr. Drew that maybe he'll talk about the crazy videos and how he really feels, stuff he can't really say publicly.
Fartist123, he says vape to cigarette is what codeine is to heroin. That is not true. Well, it's sort of true. It's sort of true. Here's the problem. Fartist, listen carefully to this. With opiates, the opioid is the problem. With cigarettes, tobacco is the problem, not nicotine. Nicotine is harmless. Unless you have some sort of delicate cardiac rhythm issue, nicotine... some people use it for weight control and weightlifting. It's used all the time. Nicotine, it's highly addictive, and it's why people get stuck on tobacco. But vaping has actually been shown to be one of the most effective ways to get off cigarettes if you're not going to go cold turkey. So again, opiate, no good. Yes, I agree. Codeine, heroin, same thing. But vape versus cigarette, it's a different thing because you're no longer using tobacco, which is strictly the dangerous part of the addiction to cigarettes.
So gum is good too.
Nicotine gum is fine. Bob Forrest has been on nicotine gum for 20 years, right?
Yep.
Maybe more than that.
That's what he says.
Yeah.
He's always got it.
Yeah, he's always on the gum. He's a drug addict. That's hard. Drug addict for people that have been really on it for nicotine for a long time is very difficult.
Maybe we should have told that guy that was on here.
No, because
he just wants to go cold turkey.
Yes, he's got a good plan. I don't want to get in the way of that. It's just much cleaner.
My dad smoked until he was in his 30s, and then he quit, and he lived in 92.
Yeah, that's good. That's interesting.
My mom kept smoking, and she died in her 70s.
Your mom smoked like a maniac.
They both did before.
Yeah. Thank you, Zen Mom. J&J vaccine better for lupus? Not necessarily. Yeah, well, Jay Wicks, there is no worry with vaping, right? There's some data now that it can damage the lining of the lungs, and there's concerns about vaping generally. But an awful lot of people vape weed, and a lot of people vape nicotine, and there's not a lot of lung illness that we're seeing from that. So I don't know. I don't know quite what to think yet. All I know is if you want to get off cigarettes, vaping can help taper you down and get off.
Well, vape pens aren't great for your lungs either. I've read.
Is naloxone a good jump off from titrations down from 360 to 50 milligrams? Boy, Texas Rav, you could trigger a pretty serious withdrawal. I like to see people off everything before I use something like naltrexone. That's me. It doesn't necessarily people. There may be doctors out there that are willing to do something a little more aggressive. Okay.
I want to give a shout out to my son who's doing a fabulous job producing this today.
Mm-hmm. And look, Rex is in on the act.
He always comes in about this time, but usually Jordan feeds him. And
I could show Rex to Instagram. Rex, come here. Oh, I know.
Oh.
Wait, where is he?
Long Johnson. Remember that
This is a
cat?
special appearance.
Oh,
Yes,
Long Johnson.
I remember that cat, Susan. Not everyone is going to remember it or know what you're talking about because that was about 7 years ago.
That was my 7. It was like 25 years ago.
No, maybe Jordan. I wonder if I hate to ask you this, but you think you could find that recording? It's very funny.
I can probably find it.
All right, and maybe right straight off of South Park. This was a video from America's Funniest Video, if I remember right, of a cat essentially attacking another cat, and it sounds like the cat is talking. Sorry to go on completely off topic with this crazy thing.
Funniest thing ever.
There it is. There it is. And let's take a listen, everybody. Oh, we have to have a Ritz commercial first.
Yeah, skip that.
We'll get to it in a second. 1, 2, here we go. Listen. Here it is.
Okay, we got to stop or we're going to get
Oh,
get in
okay,
trouble.
yeah.
Trademark.
Okay. We only get a few seconds before YouTube decertifies us or whatever.
It gets better, though.
But if you watch the South Park, they literally have humans voicing what the cat was saying. Do you remember that one, Jordan?
Oh, do I?
That was a good one.
This is what it's like growing up with a mother like me. It's like, oh, Long Johnson.
All right. Oh, okay. All right, let's get back to the question. Methadone to Suboxone will make you so sick. Lormsby, it can make you so sick unless you get way down on the methadone. It can be a little challenging sometimes, but it is a good move. If you can get methadone to Suboxone, you're in better shape. You're not on the couch the way methadone leaves you. There are some people remembering the South Park episode.
Yeah.
And somebody says, this is why your show is not monetized.
Yes, it is.
There you go.
I hate to tell you. Somebody does pay the bills.
Okay. Somebody says there's a mass, Joe Giannotti saying, a mass campaign right now for World Health Organization to approve ivermectin as a treatment for COVID. They had come out at one point sort of modestly in favor of it. I took it. It didn't do much for me. It's done something for some of the long haulers. I may have taken it incorrectly. I took it day 1 and day 3 as opposed to 5 days in a row. But you know, there's there's not much we can do early in COVID, and so I would think we'd want to do anything we could with a medicine that has a long safety record. Fluvoxamine is something that's also advocated early on. And so you might, again, if you talk to your doctor about fluvoxamine, if you get sick, I think it's a very harmless, easy way to go. All right. You guys, how long have we been going here?
Pooping out?
I'm pooping out a little bit. Not in a bad way.
40 minutes.
Okay. Well,
That's okay.
I should keep going.
You've been dual tasking. It's a lot of work with the Instagram Live.
It is a little challenging with the two shows, the two threads.
I think when we do Clubhouse, it's easier to pull people up because it's sort of made for that. But
well, it's easier because I don't have 2 threads.
Yeah.
With
You're not
this
acting
one,
for both.
I'm looking. I have to read both threads.
But we wanted to make it accessible to everybody today.
Okay, here's a good question. Leaping lizards. My partner got warts all over his penis after unprotected sex with someone else. Will the HPV vaccine protect me from getting this? How long after taking the vaccine is it safe? That is, I do not know the answer off the top of my head, and it's not. Gosh, and remember the HPV vaccine is a 6-month multi-part vaccine, and you want to take till you've taken all parts. I think it's 6 months. It's several months apart. It's a 3-parter, so you're going to have to lay off for a while. But I would have to look it up, frankly, to see how long after the 3rd vaccine you're good. I know you have pretty good immunity after the 2nd, but here you have somebody with high viral load there with all the warts.
So I found out that you don't want to get the passport vaccination thing. You want to just bring your card with you. So you need to make sure you hang on to your vaccination card when you travel, because they're going to want to see that in order to go internationally.
Why not a vaccine
because
passport?
it's better to have the card.
Oh,
and that's like a passport. So I'd say staple it to your passport. Or
what's the best way to treat?
Take a couple pictures of it. Make sure you have it on file.
Weed oil for osteoarthritis. I don't object to that, Kathy. If you're not an addict, if you don't have that risk for addiction, then it's not a big deal. Sound audio sucks today, they're saying.
Who says that?
I don't know.
It sounded fine to me.
Let's see who else agrees with that. Please interview Professor Sunetra Gupta. Okay. I'm going to be interviewing the doctor that does this podcast called Plenary Sessions. There are 3 people I want to interview coming up. Plenary Sessions. Let me get you his name. What's that, Susan? Are you saying something to me? I can't hear you.
Got to turn my mic on.
Yes.
I'm letting Jordan decide. He's mad at me. We have a couple of guests coming up. We have Dr. Knock coming tomorrow.
Yes, I want to talk to Dr. Knock. He is definitely somebody I want to talk to.
And then
the other is Vinay Prasad. He is Master in Public Health from San Francisco and an MD and an oncologist and really a smart dude. And he has a podcast that he's been really. He does an excellent job of reading medical literature, and he is looking at what we've been doing from a public health perspective and thinks we could do a better job. It's all I've been saying since the damn beginning.
But then we also have Dr. Ben Carson on Wednesday.
Ben Carson's coming in here, former Secretary HHS or HUD of HUD.
Ran for president.
Let's see. Yes, Moresque. His name is Vinay Prasad. Thank you for that. Katie Porter just had operation with Chris, so we could maybe bring her back to give a report on the operation. And the vaccines do not change your DNA. And to that ends, I want to talk to a woman. Jordan, put up her TikTok. It's at Laughter in Dark. Laughter in Light. At Laughter in Light. And she's a virologist. I follow her on TikTok. She does an excellent job of dispelling all the nonsense. Dr. Knock does too, but she gets into the weeds a little bit. She's a laboratory. There it is. She's a laboratory virologist and gets way into it. I recommend you guys follow her. I go all the way back to the beginning. She has dozens and dozens and dozens of explanations in there of someone who works in a virus lab. She's an immunologist who's working in research actively and was part of the army.
Maybe we should have her on with Dr. Knock at the same time.
And it's different. They're different. She's more immunologist. He's more virologist. And but I'd like to interview them both. So between the 3 of those professionals, we're going to have some very interesting conversations coming up here. Anything I can do when coming off Klonopin? Patriot woman wants to know. Yeah, you can try gabapentin and phenobarbital, or talk to your doctor about gabapentin or phenobarbital. Both can be helpful, and you're going to have trouble sleeping for sure. So those are still the 2 mainstays. If
this
you
is
get
a really long
dose.
Instagram live. Maybe we should let everybody go.
Okay.
If they want to head on over to the Restream and see the rest of the show, you could do that.
Okay. So we thank you on Instagram Live for being part of this. I'm going to talk to the Instagram Live right now for giving us the questions today and for being so active. And generally, although we had a few trolls rolling around today,
whatever.
Instagram Live is generally a place I really appreciate and kept me sort of sane when I was sick. So I really appreciate you guys.
No, we love Instagram people.
Yeah, I do.
They're very nice. Lots of nice women too.
Carrie Oda wants to talk about Wellbutrin another day. I feel bad asking. Go ahead and ask. Wellbutrin is it's a noradrenergic agent. It's sort of different than the serotonin reuptake inhibitors, and it's not for everybody. Trust me.
It doesn't take your sex drive away.
That's the main advantage to Wellbutrin, right? But it can be problematic for all these medicines. These are listen. Let me state a general statement before I wrap up the Instagram. All medications are dangerous. All medications are dangerous. Even supplements anything that changes your physiology is dangerous. Has to be assessed properly so you know that there's a diagnosis that you're taking it for, so you can assess the risk reward. And somebody objective who's well trained needs to be evaluating you while you take these things. It's all dangerous. Medications are dangerous. It's only when the risk reward warrants you taking it. So let's be clear about that. We've had a weird shift in this country where we start believing that medications make us better, make life better, make humans better. No, they make you better when you have illness, and it's worth the risk. And we have lots of good medications now, and to be clear about this, as an internist, somebody who doesn't use a scalpel, the only thing I have is medication. That's all I have. That's what we use to change the natural history of illnesses is medication. But if we don't take the position that medicines are dangerous and bad, we end up hurting people. So there you go. It's when the risk is worth the reward.
Can I say something about Wellbutrin? Because I did take it.
Yep.
You prescribed it to me when I was having
I did not
panic
prescribe
attacks.
it. Somebody did prescribe it.
Yeah, but we considered it because of the fact that it didn't change my libido. But It was good when I was depressed, but I was having hormone problems, which I didn't realize.
So they misdiagnosed you.
Right. But I took it and it made me feel better because I was having anxiety attacks and getting super depressed with triplet 5-year-olds or 4-year-olds or whatever it was. But I did have, had some consequences. My hair fell out.
Right.
So I had thinning of hair.
Yeah.
But that was pretty much it. I was happy to get off of it eventually and get on hormone replacement and get my hair back. But then, of course, the hormone replacement made my hair thin again too. So,
it was so specific to your diagnosis, it became worth the side effect.
Better,
yeah, when you had something that wasn't right for your diagnosis, it wasn't worth the side effect. Hey, let me say, Mariko Vyatsu-Burt, even aspirins are dangerous and have side effects. Absolutely.
Yes.
Aspirin can cause ulcers and GI bleeding and bleeding into your brain. It can be all kind, and you could have some of an inborn error of clotting, like a factor V Leiden factor, in which case aspirin could be really problematic for you. Tylenol. 8 Tylenol will kill you. Again, these medicines, all medicines, just because they're over the counter doesn't mean they're exclusively safe. It's when the risk-reward analysis makes it worth it.
Follow your doctor's orders.
Yeah, Artrosia is better than pellets. Susan likes the pellets, although you use the Troche sometimes too, right? Yeah, so,
I do.
But the pellets give us smoother results. So, all right, bye Instagram. Thank you guys. We appreciate it very, very much. I'm going to share it to IGTV. All right, let's go back to you all on the restream here. Joe Giannotti says aspirin, Tylenol, actually one of the 50 most dangerous drugs. In terms of suicide, yeah. In terms of suicide. Pocket pull of Posey, you're doing good there? All right, come on, man. Here we go. I'm looking through. I haven't seen it. I'm looking back at your guys' comments because some of it I missed because I was on Instagram. Yes, Anthony. I missed what you said, but I'm happy to give you a hug. But if I'm going to give you your chip, we have to figure out how I do that. You're down in Orange County, unless you'd go to a meeting up here. I've given cakes and chips before, and I always like doing that. Certainly, I'd be happy to do that for you. You have scleroderma, afraid of the vaccine. Should not make you any added risk with the scleroderma. In fact, you'd think you'd want to get the vaccine because the restrictive lung disease of scleroderma could really make COVID a big mess, humbly. Fartist, why this isn't the first time vitamin E was used to cut EPENs. Why didn't people get pneumonia from previous batches? I don't know the answer to that. That's an interesting question. What is the law in California for drug step therapy in regards to RX and insurance companies? With Chris, I don't know what you're asking. There's very little to protect the patients from the insurance companies here, to tell you the truth. If you're getting close to the outside, most people appreciate a mask up. Steve Simpson, here's a fact. Are you ready? There's never been a case documented outdoor transmission of COVID. 2 cases suspected in China out of the 150 million cases documented so far. 0 outdoor transmission. 0 outdoor transmission. Fact check me on that. If you can find a case, I'd love to hear it. But there were 2 in China that were suspect. Otherwise, 0 cases of outdoor transmission. So if you're wearing a mask out of doors and you're more than 6 feet away from somebody, you are signaling only. You are doing nothing for COVID. That is strictly a virtue signal. Strictly, as far as I can tell. Please check me on that. Step therapy. Oh, okay, Chris, I hear what you're saying. Yeah, they insist on you going through all kinds of other medication before they'll prescribe the things that are likely to work, just because you have to prove that the other ones don't work. Yes, there's a lot of that. There's a lot of that out there. Correct, Rick Green, UVC. I'm all for UVC. I recommend we move about with a UVC thing called an eye wand. This is what we use all the time. 10 seconds over a surface, extremely effective at killing bacteria and viruses. So we thank our people at Optech for providing us those eye wands. I strongly recommend those. When we go on a plane, Susan, we're wild with our eye wands, yes?
Radically wild.
Radically wild.
So
Anthony
Brown has 20 years sober, 22 years sober.
Who does?
Anthony Brown. I think that's what he said.
Is it 22 years? Well,
It's typing into my Twitch thing, so this may all come through.
Well,
God.
we'll go give him.
I can't get it to
We'll give him a
stop.
cake. I'll happily go with you.
I can't make cakes. Can I make a mistake?
No, you can go to like Vaughn's and get a cake. You can. It's okay. It's the idea of the cake.
I get it. Congratulations.
And by the way,
Anthony.
in terms of making masks more effective, this in the nose and mouth, much,
we're going to
much
take
more
our
efficacious.
I1s and our Halodyne.
Yeah, we're going to go travel, and we take these
Greece.
things when we travel. Absolutely.
We're going to make.
It's looking like I'm going to have to go to New York before Susan. Now we're finding out in about a month. I'll be coming up in May. Interestingly, I'll be coming up to New York in May.
And
you
also
better
in
believe
June.
I'm coming up in May. For those of you from Mom's house,
Teen Mom. Boop, boop.
Yeah, Teen Mom reunion.
We think, I don't know.
And
We'll
for
find
that,
out.
I will use the use
They
the
have to get the
Halodyne stuff.
studio. So
Yeah. All right, I think I've about. I mean, it's a Sunday. Let's make it a little bit short. Put it on Reddit. Somebody says, Alex, what do we want to put on Reddit? Wish Chris going to New York in May too.
can we
Susan.
do live stream on Reddit?
I'm online for ketamine therapy for my depression. Should I go? Jay Herrera, ketamine therapy can be very effective.
I'm so proud of Jordan.
Yeah, he's doing a great job. It can be very effective, ketamine. I've seen trouble with it with addicts, so be careful if you have alcoholism or addiction. But I still wouldn't categorically say you shouldn't. If you're resistant to other interventions, it can be very effective. Spotify has live streams, so it says Fartis. So we can go on Spotify.
They do?
We'll try it. We got to go. We're trying all things, guys. So we appreciate you.
Well, if
being a
Restream
part of it.
connects to it, we could set it up. No problem.
Yeah, we have a system.
I mean, Periscope's going away, but it's turning into Twitter. So I think we're going to still be over there somewhere. We're not sure. Scott Adams doesn't know. Nobody knows.
Charging magic missiles. Do not treat yourself with ketamine.
Don't you find it weird that a company doesn't tell you where all your audience is going to go? Like if you have 100,000 followers, like where they're going to go?
Anthony, I hope you're not high right now. Listen to this. What Anthony says. A bobblehead would be crazy groovy. Can we get on with a dumpster with removable cheeseburgers? Dude.
What?
I don't.
So we are working on a bobblehead. Well, Iona, one of our locals followers, she's been trying to contact me, but I've been a little busy the last couple of days.
Here is my Anthony
And
Fauci bobblehead.
It looks just like you. Can't we just say that's you?
Well, I need the hair a little shorter and the nose not quite so big. And let's do that. We can.
You have a
change it
cuter
around.
nose.
All right. So did I say I was on Instagram live streaming? TS, I was. Now I'm off. We're trying all different kinds of platforms and experimenting.
We also use Clubhouse.
Use Clubhouse for phone calls. We're just trying different things. And it's interesting to me how different the sort of people are in each of these platforms.
Yeah.
They're different. I mean, we could do a live, you guys, we could do a live on TikTok too, but I don't think you can bring people up, can you?
No.
There's
You know,
laughter and light again. That's the
it's funny though.
Immunologist.
Oh.
What is that?
Ding dong. We have to figure out how to turn the sound so we can see their faces on Instagram Live. But the thing about Instagram Live is it's predominantly women, and all men came on except for one today.
Oh, that's interesting.
Yeah, funny.
So whatever that means.
Because they
I
didn't
don't
want to be
know.
live. They didn't. They have a hair and makeup done probably or something.
People are usually not our first caller. I think she went on. Our first caller was a woman.
Yeah, we had a woman.
And she was your Mom's House
One out of
fan.
4.
Ding Dong is the new TikTok. Be World, educate me. This is all new territory for me, so please.
I know nothing of it, so don't get me involved.
My live on Instagram with Bert the other day was great. Bert Kreischer was on with me, and then Lonnie Love was on me yesterday.
I know.
I just caught them.
Nobody came on today.
It's all right. It's fine. I wasn't looking that carefully. I was doing two things at once.
I know you did a great job. I'm very proud of you for the
Am
new
I
technology.
Steve-O's friend? C for Loom. Yes, I'm Steve-O's friend.
The opening was a little rough, so when everybody comes on, they're going to go, "What? There's no sound." So that'll be funny. I think you can crop it though. Can you crop an Instagram Live?
Interesting question.
I don't know. It's something.
I'm just going to throw it up.
It's
I
not
don't
going
know.
to win any awards or anything, but I'll let Jordan decide that. Jordan's now taking over some of the technological jobs that I couldn't ever do. So
Hey, C for Loom, I'm fine. Thank you for asking. Somebody says they missed me in the machine, but it's on my Instagram. I posted the whole thing on Instagram. You can find it there. It's like from 2 or 3 days ago.
did you put something up in the blurb so people know that?
I did.
Okay.
Fartist is saying the more anonymous the comment section, the more absurd the comments. I think you're on to the correlation, but I still think that there's kind of a different character of people that hang out on Instagram versus TikTok versus certainly
Clubhouse.
Rescream, just Clubhouse, different.
Clubhouse is more elitist-y. You have to have an iPhone. I don't know. You have to be invited. kind of weird.
Double J, even with the lupus, you should be fine. You should be fine.
We just want to phase out the phone calls with the call-in studio because it was just so much effort.
It just didn't really work. It just wasn't good. And we had
And
the
it cost
same
us
we had the
money.
same system on your mom's house for a minute, and we canceled it there too.
It's $100 every time I do it.
It's just whatever reason people would rather just jump up on Instagram. It's a different world right now, right? They don't want people don't call into radio shows so much. They want to jump into a conversation.
I mean, you
on
don't have any
social media.
problem with the Dr. Drew podcast because people are like waiting to do that, and because you've been doing it for so many years. It's just hard, and then you get the same people calling over and over.
You're
again.
right. That's interesting. Yeah, and me and Adam and that's sort of the Corolla world. The Corolla world is sort of more on the phone, and it's more people that are 30 to 50.
And there's no video.
That are used to calling in.
There's no video, so
yeah,
it's kind of weird to go from a video and then pick up a phone and.
Curb Dog CoQ10 is a good anti-inflammatory. I'm not sure it does very much. I take it. I've resisted taking it for a long time. Been taking it lately because I'm trying to do everything with COVID flying around. Is telehealth effective for therapy? Melissa, it is to a point. But because if you watch Dr. Alan Shore's interview I did from last week, we talk a lot about the limits of Zoom therapy because you have to have two bodies in space to really to build that regulatory system. All right. I think we should wrap it up, everybody. Thank you so much for hanging out.
See you guys tomorrow.
We will be in here tomorrow.
3 o'clock.
About 3 o'clock. Same team running the show here.
Yep.
Jordan can do it again.
I guess. I don't know. Well, he has class at 4.
So Susan may be running the show here.
Or Caleb maybe.
And Caleb can't come in tomorrow, he said.
Oh, okay.
So it's going to be you or Jordan. And oh, hi from South Africa. My goodness.
I think I'm okay.
Just had blood from kidney. Can't remember name. Under 100. Oh my gosh. I'm sorry, Narkells. I can't really read what you're saying there. Husband stopped taking statins for hereditary hypercholesterolemia. Been on it for 15 years. If he has hereditary hypercholesterolemia, he has to be on a statin. Just had blood from his kidney. That could be kidney stones. Who knows? Would Adam Carolla ever do Doctor After Dark? I was just trying. You know what? That's a good idea. Let me see if I can get that. Well, we do it way out in the valley, and I don't know if he would be willing
Rex
to drive
doing
out
over there?
He's digging a hole. I know. Now he's in my face.
This is what he does every day at the end of the show. He wants dinner.
You bet, Suzanne. King and Queen above 18. Thank you for the Kings and Queen above 18. Those of you from your mom's house know exactly what I'm talking about. All right. Thank you for guys, and we will see you tomorrow around 3 o'clock. This pandemic began, we were not sure how it spread. Everyone began wearing masks and using hand sanitizers. Great ways to slow the spread, but a lot of people still get sick. I can personally attest to that. We now know that COVID-19 spreads via aerosols and droplets from the nose and mouth, and I've been thinking about this for a while. Why aren't we also sanitizing the nose and mouth, killing the virus directly at the place where it spreads? Why weren't more doctors thinking about this? Well, some doctors have done the research. Wish I discovered it sooner. That's why I'm excited to tell you about Halodyne. It's an FDA-registered antiseptic for the nose and mouth that's proven to eliminate 99.99% of the virus that causes COVID-19 in just 15 seconds. That's right. It's created by a team of clinicians with decades of experience in antiviral treatments, initially created to protect healthcare workers. These are smart scientists, and it's a great product that also eliminates many other viruses and infecting particles. I'm using both their nasal antiseptic swab and their oral spray to help protect those around me, and you should be too. For others and for yourself. Whether you're hopping on a 3-hour flight, always use it there, visiting grandparents or attending a meeting that you can't miss, Halodyne's family of oral and nasal antiseptics give you the safe, easy, on-the-go antiviral protection for up to 4 hours. I encourage you to try Halodyne at halodyne.com today. My listeners get 10% off with the discount code Dr. Drew. That is HALODINE.com, discount code DRDREW. So obvious. It just makes sense. Stop the virus before it spreads and gets in your body with Halodyne. I am so grateful for our friends at Blue Microphones. Not only have they completely changed what our show sounds like, they've given me headphones so I can monitor things better. This is the mic for millions of creative people, and now I know why. I'm so grateful for them completely changing the quality of our audio. You'll find Blue mics like Yeti and the Mouse, which we're using here, both in pro studios and home studios, literally all over the world. Their popular Yeti caster is a Blue Yeti microphone, plus a boom arm system that's behind many of your favorite podcasts. I run into them all the time, and now I know why. If you've ever thought about creating your own podcast or YouTube channel, Blue can make you sound and look great. Just visit bluemic.com and click Get Started, and you can start telling your story.